Hi, I'm Tori, and I am a doctor of physical therapy who specializes in pelvic dysfunction, and today I want to answer a question that I've received multiple times, which is essentially, what can someone expect? What happens during their very first pelvic physical therapy appointment? So, first and foremost, when walking into not only a pelvic provider's office, but any provider's office, it is really important to remember that you are in control. You are in control of what information you share, and you are also in control of what happens, if anything, to your body, which means that you can say no, please stop, even after you've said yes. Try your best to carry that autonomy into every provider interaction, because your story, your body, and your health belong to you, but especially into pelvic provider interactions, because the pelvis can be such a personal and emotional space for a lot of us. That said, your appointment will begin with your therapist taking what's known as a subjective history, asking you about what's bringing you into pelvic physical therapy, asking you more about the story that you have surrounding your pelvic dysfunction, asking you about past medical history, medications that you're taking, supplements, and things of that nature in order to piece together a more complete picture of you. Your therapist, depending on how they were trained, may or may not also directly ask you about a history of trauma. And the reason that they may ask is because trauma and pelvic dysfunction, especially pelvic pain, can be very intimately related, and knowing about someone's history can inform treatment style. That said, you do not need to offer up that information if you aren't comfortable. There has been plenty of time in my practice where that kind of information is shared with me on the second, third, or fourth appointment after the patient and I have established a relationship. And a good pelvic PT will make any patient feel supported and comfortable and in control, regardless of that patient's history. Next, depending on your subjective history, your therapist may perform a more global general orthopedic assessment, looking at the way that you move, looking at your muscle length-strength relationships, assessing the integrity of certain tissues and that sort of thing. Or they may move directly into a pelvic exam, which again, you are in complete control of the entire time. You do not need to undergo a pelvic exam if you don't want to. And as I always tell my patients, if at any point during the exam you start to feel uncomfortable, tell your therapist and they'll stop. That said, the pelvic physical therapy setup is a lot different than the gynecologist or urologist setup. There are no stirrups and there are no instruments like a speculum, and there's also no bending over the table in order to have a pelvic exam. Instead, there will be a comfortable table in the room where you can lay down that will have a sheet on it, and your therapist will leave the room to give you some privacy after asking you to undress from the waist down, removing pants and underwear, lay down on the table, cover up with the sheet, and then your therapist will knock on the door before re-entering the room and beginning the exam. Once your therapist returns, they will likely help you get into an even more comfortable position. The position that I often help patients get into is what I call a supported butterfly, which is where someone is lying on their back, their knees are bent and out, and then there's pillows underneath their knees in order to give them even more support. Now, there will be an external and, with your consent, an internal portion of the pelvic exam. The external portion will be completed visually and with a gloved hand, and the internal portion will be completed with a single gloved lubricated finger. For the external portion, your therapist will lift the sheet back and begin by observing your tissue, observing your skin. And if you have a penis, your therapist may ask you to gently hold and lift testicles and shaft just so that they can better visualize that tissue. Then, with a gloved hand, your therapist may start to palpate that tissue, assessing the aspects of the pelvic floor musculature that can be felt externally for tenderness, integrity, and that sort of thing. As an aside, I would get this question sometimes in the clinic. You do not need to groom your pubic hair for your therapist. We are not passing judgment on the presentation of your genitals. We are assessing integrity and function. Now, I have had a handful of patient experiences where we've decided together that changing their pubic hair would be helpful for treatment, but those choices had nothing to do with appearance and everything to do with the ease at which I was able to perform different kinds of treatment techniques. That said, for the internal portion of the pelvic exam, if you have a vulva, you'll likely stay in that supported butterfly position, and your therapist again will use a single gloved lubricated finger, most likely inserted vaginally, in order to assess the different muscles and layers of the pelvic floor. Once their finger is inserted, they'll drape the sheet. They don't need to see anything. This portion of the exam is all about feeling, and they'll keep a conversation going with you, sharing what they are feeling and also checking in with you to see what you're feeling throughout the process. Your therapist may need to switch sides during the internal exam in order to do a more complete exam. I'm sure you can imagine that if I am on the right side of a patient using my right hand, it's a lot easier for me to assess the right side of their pelvic floor. And I may want to move over to their left side and use my left hand in order to assess the left side of their pelvic floor. If you have a penis, your therapist may keep you in that supported butterfly position that we were talking about earlier, or they may ask you to get into a side lying position. Either way, your therapist will still use a single gloved, very lubricated finger, this time inserted rectally, in order to assess the different muscles and layers of the pelvic floor. I want to pause here and share that any therapist that is performing a rectal assessment has had multiple rectal assessments performed on them. That's how we learn. We practice on each other. So we will do everything in our power to make sure that this assessment is as comfortable and easy as possible. That said, again, your therapist may need you to switch positions in order to get a more complete assessment of your pelvic floor. If you are in side lying, that would just mean getting onto your other side so that your therapist has an easier time accessing the other side of your pelvic floor. And once the pelvic internal assessment is complete, your therapist will then leave the room to give you some privacy after showing you where the trash can and baby wipes are located in the office so that you can clean up, get dressed, get comfortable, and then you will hear another knock on the door before your therapist re-enters the room. Once your therapist is back, the two of you will discuss their findings, a home exercise program, frequency of upcoming appointments, and that sort of thing. All right, I hope that this video shed some light on what to expect during your very first pelvic physical therapy appointment. And also, please remember during any provider interaction that you are always in control. Your body, your story, and your health belong to you. They are yours. And also, please always remember to trust your gut. If you don't feel like the pelvic physical therapist or any other provider that you're seeing is the right fit for you for whatever reason, that's okay. Seek out another provider and don't do anything that you don't want to do. On that note, thank you so much for watching. If you enjoyed this video or found it helpful, please do give it a thumbs up. And if you didn't like it, let me know what I can do to improve in the future. Feel free to comment absolutely anything down below. content suggestions, questions you have, feedback, personal experiences if you're comfortable sharing them, really anything. I do try really, really hard to read and respond to all of my comments. Don't forget to check me out on Instagram, and finally, if you want to see more content from me, please do consider subscribing to the channel. I make videos not only about pelvic things, like today's video, but also about life things. Thank you again so much for watching. I hope that you have a wonderful rest of your day, and I will see you in the next video. Bye.